Hi, I'm Dr. Sandra Lemanski, optometrist at Parmer Eye Care, and I wanted to talk to you for a moment about dry eyes. That's something that we kind of specialize in here at Parmer Eye Care. I personally have dry eyes, and so I like to treat them. I like to get all of the possible treatments available in our office to help with my patients' dry eyes as well as my own. So whenever we see a patient who has dry eyes, oftentimes it comes up in the routine exam. And so we'll talk about it a little bit there, but we'll usually bring them back for a visit that we call a dry eye evaluation. And at that visit, we are going to check the function of the glands around the eyes that help produce a quality tear film. We're going to look at the stability of the tear film across the surface of the eye using some dyes and different things. And we've got a questionnaire that we run through about symptoms. And we'll go over this information with the patient and we'll come up with a plan for what's going to be the best way of treating their dry eyes, because it differs. There's different types of dry eyes. Most commonly, it has to do with these meibomian glands that are in the lids of our eyes. And they produce the oily part of our tear film, and that's what helps to stabilize it on the surface of the eye. And it also lubricates the surface of the eye. You can imagine oil is a little better lubricant than just water. So we look at the glands, we check the function of them, and if they're not functioning well, then there are several options that we have in our office to treat them. What we've had for some time is called LipiFlow. That's an in-office treatment that sort of warms and massages these glands in the lids. And then there's also supplements that patients can take. There's things that they can do at home that we can recommend. And yes, there are eye drops, and sometimes I'll prescribe eye drops, but that's not necessarily going to improve the gland function. It may help with the symptoms, and it may reduce inflammation and help that way. But to get these glands functioning better, it usually takes something that we can do here in the office. So we've got LipiFlow. We've had that since about 2018. We just recently added IPL to the types of treatments that we can do here in our office. That's short for intense pulse light. And you may have heard of that before in the aesthetics industry, because it's been used for like almost 30 years for treating things like fine lines and wrinkles, dark spots, red spots, smoothing out the surface of the skin, and improving the collagen in the skin, as well as treating rosacea and reducing those little visible blood vessels in the surface of the skin. So that's what IPL has been used for the past several decades. But now we've discovered that when we treat those patients around their eyes, in the skin of their eyes, it actually helps get those glands functioning better, and it relieves their dry eye symptoms. So now it's being used by eye doctors to treat dry eyes. And guess what? You still get that kind of I call it a happy side effect of reducing fine lines and wrinkles and smoothing out the skin and all of that stuff. But it really does, and it works well with LipiFlow. We can do some IPL and then do a LipiFlow treatment, and that just makes both of them work much better. So that's a couple of things that we can do here in our office for our dry eye patients. I'm really excited about the IPL. I'm going to be having it done on myself as well. I've had one treatment. It takes a couple of treatments, or maybe 4 treatments, to really get the full effect of it. So I'm excited about that. But anyway, I just wanted to let you guys know what's happening in our office with dry eye treatments. And if you find that your eyes feel dry, or if you're having a hard time wearing contact lenses comfortably, or if your vision fluctuates a lot with blinking, or if your eyes tend to burn and feel uncomfortable, especially if it's after using the computer, this is something that may really benefit you. So give our office a call. You don't actually have to have the routine exam first. If you have dry eyes and you want to do something about your dry eyes, you can just call our office and say, hey, I want to schedule one of these dry eye evaluations, and we can do that for you. So I hope to hear from you soon, and be well.